So, components of a program. I mentioned the experience of the surgeon is very important, and it truly is. Again, we've operated on over 6,000 patients in our program, but it is important to seek out an experienced program. But it's not just the operation. The operation is only a small window in time. This is for the rest of your life. So it's also important to have a program that you have access to. People who can help take care of you. Surgery, to have surgery, for those of you considering surgery, again, remember at the very first slide was, is it right for you? Because if someone's medically fit for surgery, that's good, and that's what we want to know. But at the same time, we also want someone who understands the changes that are necessary to be successful. So there's that lifestyle change that goes with it. So the operations are not necessarily for everyone, but if you've looked at it, researched it, considered it, the operations truly are effective, very effective, but you do need to work with it. In order to meet criteria to have surgery, the biggest thing that is looked at is BMI, that body mass index that we talked about, which is just your weight relative to your height. And again, BMI 35 and above are the traditional criteria for surgery. Recently, the FDA is in the process of dropping that down to a BMI of 30 for the ban, but for now, BMI 35 and above are the traditional criteria. Also, a history of being severely obese. It's not for someone who just gained weight 6 months ago and now they're looking to lose the weight. It's somebody who struggled with it for most of their life. Documented diet failures. By this time someone comes to a surgeon or a surgical program like myself, most people have dieted many, many times and they've been successful in losing the weight, which is expected, but keeping it off is what's really next to impossible. But remember what I said, 99% failure rate with severe obesity and gaining the weight back. So those are things that we expect. What you will find from an insurance company standpoint, sometimes an insurance company will require a medically supervised diet prior to being approved for any weight loss surgery. That's just something that we gotta deal with, and we can help you set that up and get that going. But that's not a bad thing. It's just, again, it kind of gives somebody a more opportunity to become more educated and prepared for the operation. Some questions that come up about medications. Medications are okay to take after the operations as well. Now, hopefully we get you off most of your chronic medicines. You know, hopefully we can get rid of diabetes and high blood pressure. But if someone still needs to take some medicine, or if they get an infection and they need an antibiotic, then it's certainly okay to take medicine after these operations. But our goal is to get you off what we can, okay? The next thing is supplements, vitamins. For bypass patients, remember I said a multivitamin with iron and B12 is very important, and that's important for the bypass patients. It's still recommended that you take a multivitamin even for the band in the sleeve as well. Interestingly enough, the biggest advance in even surgical outcomes and results in the last few years has been the advancement in our knowledge about nutrition. Nutrition has been what's helped us get better results, and that may be with more protein, with better supplements, that kind of thing. There are actually manufacturers and companies now that make vitamins specifically for bypass or patients who have had their anatomy changed. So those are things that we'll go through and you'll learn more about as you go through the process, but those are very important. And the last thing that we're going to talk about is the diet. And when I say diet, I just mean the food that you eat, not a diet like, you know, starving yourself, but just the diet. So, very simple. Diet's very simple. 3 meals a day, breakfast, lunch, and dinner. So, breakfast, lunch, and dinner, nothing in between. There's 3 basic principles to the diet. 3 meals a day, breakfast, lunch, dinner. The size of the meal, because we've reduced the size of the stomach. So remember, our goal is to have a more normal amount of food. Size of the meal is 4 ounces by weight. That ends up for most types of food being about a salad plate of food. So three meals a day, breakfast, lunch, and dinner, 4 ounces per meal. And the type of food that you eat is important as well, because our bodies need protein to function. Carbohydrate, the body doesn't really use, and it gets stored in as fat. So it's important to those meals to concentrate on more protein type foods. Now, it's not an Atkins diet, so it doesn't mean you can't have carbohydrate. It just means that you should focus on more protein type foods. So meats and vegetables would be better choices than carbohydrate food like bread and pasta. A couple things about carbohydrate food, bread and pasta. think about it for a minute. Those types of foods are soft, right? So if you put bread or pasta in your mouth, it's going to dissolve, right? So it dissolves, it just goes through the system pretty easily. So it just flows right through the system. The system is designed to hold solid food. So if you eat a chicken or a piece of meat, it goes down in, it fills up that small stomach, and it stays there for a longer period of time, so it satisfies you and keeps your hunger away for a longer period of time, versus carbohydrate food that just goes right through. And the second thing about carbohydrates that is bad is that carbohydrates actually stimulate appetite. So it actually makes you hungrier, and since it's soft, you can eat more of it. So those are things we want to try to minimize. Doesn't mean you can't have them, just we should minimize them, because the protein foods, one, protein decreases appetite. Second, it fills that stomach up and makes you feel satisfied longer. And third, it's the food that our body actually needs. It needs protein. We need protein to function. So those are the principles. 3 meals a day, 4 ounces per weight, protein type food. If you do those 3 things, you will lose all of your excess weight and you will never gain it back. I guarantee it. You can't, because it would be impossible. There's not enough calories in that amount of food and that type of food for 3 meals a day at that amount to have excess to store as fat. So again, the satiety has been satisfied because we've got the smaller stomach, signal goes back to the brain that says you've had enough. Appetite doesn't really matter, because it doesn't matter how big somebody's appetite is. If they're satisfied with a small amount, that's the goal. And metabolism hasn't come into play because there's only a small amount that has come in, and there's not enough for metabolism to cause a problem by storing it as fat. So again, those 3 simple things, 3 meals a day, 4 ounces by weight, protein type food, you'll lose all of your excess weight and you'll never gain it back.